This is a case of seborrheic keratosis located in the lap-cow area of a relatively young gentleman who is only 35 years old. He recently developed such a noticeable growth that it truly frightened him, largely because the lesion first appeared only 4 to 5 months ago and has since progressed at a relatively quick and alarming rate for the patient. The affected area became heavily covered with thick crusts, which began to form shortly after the initial irritation. There was a history of relatively strong and prolonged sun exposure, meaning the patient spent a significant amount of time outdoors without protection. This specific patient came to our clinic presenting with such a complex lesion for evaluation. Consequently, a detailed dermatoscopy was performed by our specialists, as a result of which a preliminary clinical diagnosis was carefully made to determine the next steps in the treatment plan. A seborrheic keratosis growth is a common non-cancerous degeneration of the aging skin surface, which only in extremely rare circumstances ever tends to become malignant. However, since the patient felt uncomfortable and the lesion was located nearby, near the base of the penis, it was decided to remove it under local anesthesia with lidocaine solution. The lesion was removed using the radio wave method, followed by histological examination which confirmed the diagnosis. Seborrheic keratosis, also known as senile wart, and accordingly this defect gradually healed, leaving a rather small scar, about 3 to 4 millimeters in diameter, barely noticeable, which was much more satisfactory to the patient than having such a relatively large lesion on the skin of the shaft. Therefore, not all growths are necessarily so frightening. Of course, rapid growth, as in this case, is one of the signs of malignancy. However, it is not an absolute indicator, so first of all, you should not rely on just one sign, and secondly, you should consult doctors who can perform a proper diagnosis and not delay this. In some cases, procrastination can... In this case, everything turned out well. Therefore, if you need a diagnosis of any kind of lesion in the genital area, you can contact the dermatovenereologists at our paid KVD medical center in Moscow. We have experienced specialists who are engaged in the diagnosis and treatment, including diseases of the skin in the genital area. We look forward to seeing you at our clinic. Also subscribe to our YouTube channel and our Instagram channel. Thank you for your attention.